Hey, good afternoon, everybody. I'm Dr. Scott Warden, the TOS guy, and today we are very fortunate to have our second real TOS patient story. Kyle, welcome.
Hi, how are
I
you?
have not heard your story in any detail, so I'm going to be as impressed as everybody else here. Why don't you just start at the beginning and just wing it? We're all excited to hear what you have to say.
Okay, well, hello everyone. I haven't really done this with anyone really, so hopefully I could tell everything that happened in my life up to this point. So this really all started in the spring of 2017. I was a full-time student at a junior college nearby, and I was taking 13 and a half units, and I was taking 3 online classes that required a lot of typing. I was a very avid gamer. I gamed all the console. I was gaming along on the PC. I took a weightlifting class. So it was a lot of heavy weight I was throwing around. I liked to text a lot. I had very bad posture just generally, and then I read books like kind of like slouched over. I just did a lot of activities that had a lot really bad posture. And as the months were going by, with I was like doing weightlifting classes. I'm like, man, my hands are feeling kind of sore. And as the months progressed, I noticed soreness in my fingers and my thumbs and my pinkies as I was gaming or holding the controller or using the mouse. So I decided to see a general practitioner here at the organization over here. First time I ever saw, because I was 18, I had to get my own general practitioner. And I go to see him and I tell him all my symptoms I'm having. I'm having pain on my thumbs and my fingers. My pinkies are really sore. And then he fully examines my hands. He does all these tests, like tests my strength. Like he just taps places on my hands. And he says he's like, I think you should just moderate what you're doing. He gives me splints to take home to wear at night. And then he didn't really give me anything to do after that. He just told me just to moderate my symptoms. So I continue. Still have a month of school left, so I have to keep on doing that with the online classes. Still a lot of typing to do, and the symptoms just got worse. It just got way worse. I was able to get through the semester fine, but I just noticed I was so off with my hands when I was gaming or just doing my schoolwork. And then when I was like gaming, I was actually having like really intense pain in my hands. It was really bad where I just couldn't hold the controller anymore, and the pain was like lasting for weeks on end. And I just couldn't do anything physically with my hands. It was just so bad. I couldn't like do any chores. Like whenever I would move the garbage strand just to bring it back into the side of the house, it would just hurt. I just couldn't grip it without any pain. I couldn't like put the dishes back without any pain. I couldn't like do anything. Like this gaming just really aggravated the symptoms like very badly in my palms, my hands. And I just remember once I was reading a book, I was just holding the book and the hands just like really just got sore, just so painful. I just couldn't grip anymore. And then that's when I realized something's really off my hands, or the symptoms of both sides. And I just kind of got to a point where I wasn't doing anything. Like I would avoid doing anything to upset the symptoms of my hands. It took a month really, and didn't really know how to process it because I never really dealt with any kind of prolonged pain. And I just got to a point where like I just broke down emotionally because I couldn't do anything physically. And I broke down in tears because my hands were hurting so bad and I didn't know what to do. I was just doing things that they say on the internet to help with your pain with your hands. And then I was calling my grandpa, like I was just so hysterical with all the pain I was dealing with. And he told me just to go back to see your doctor. And I do that. I go back to the doctor, and I'm trying to remember what exactly he wanted me to do. He just did the same kind of thing with my hand. He examined the hands, the same thing he did the same before I saw him, and I told him everything. But he didn't really want me to do any. I don't recall him wanting me to do anything at that moment. Like he just said, like he didn't see anything at the moment. He was talking about like doesn't want to do cortisone because because of my age. He says he wants me to avoid surgery. With that was really I didn't get any plan to do something or any diagnostics. I mean, I actually was given to do an X-ray for my hands, and that they didn't find anything with that. But other than that, I can't remember anything at that moment. But my aunt, I have an aunt in my family who's a doctor, so she's really familiar with the system. She was really pushing me to push for see a hand specialist because the nature of my hands were just, I was dealing with the hand symptoms, and I pushed for it. And then he says like, I'm only going to refer you to a hand surgeon if you're a surgical candidate, but I'll refer you to an occupational therapist. And so I said, yeah, let's do that. And I do that. And the sessions go by. I don't think she told me what was going on too, but she was like always saying like, man, your hands are so cold all the time, but your circulation is really good. I'm like, oh, wow. Okay. And then she gives me like these stretches to do. Then I don't really feel that better. The treatment didn't really help at all. It's did ultrasound, all that stuff. And one second. I'm trying to remember because I keep messaging him. I really want to see a specialist, and he didn't want to budge. He said, I only want to see me want me to see a specialist if I'm a surgical candidate. And so he had me do a blood test.
Kyle, was this your primary care doc or the hand
yes.
specialist?
Yes. Oh no, this is the primary care doctor I've been messaging. Okay. So I message him, and he orders me a blood test. I think it's the B12. There's one of those tests they do for like nerves, and then he orders like a EMG at the end. Later, I do the blood test, and I pass that. Of course, like nothing, didn't find anything significant. And then he orders like an EMG. So I go see a musculoskeletal specialist who does the EMG. Like he puts like this thing on my hands, and he like jolts it whenever like to see the nerves. And it was actually really hurt. It was actually hurting a little bit when he put it on certain places. It was just so sensitive. But yeah, he said like, oh, I passed it. He didn't really tell me anything to do after that. And then like I just walked out like with no plan. I'm like, okay, I'm gonna message my general practitioner again. And then I tell him like, hey, I passed the EMG. I really want to see a hand surgeon. And then he's like, well, so you reached the end of all my medical advice. We've done everything I recommended. You're not a surgical candidate, so I'm not gonna let you see a hand surgeon. But then he said at the end that you're more than welcome to see another person. So I'm like, okay, I'm kind of done right now. So I see another general practitioner. That didn't really work out too, but she had me like, I was taking.
If I could interrupt, this is all within the same medical system.
It's all within the same medical system, yes. So I see another general practitioner. She has me stop taking this acne medicine that I was taking orally. She was like, I think she was theorizing or thinking that maybe the pain was causing joint pain. So I stopped that, and of course it didn't change anything with my pain. And then I was like kind of pushing for her to see like with the musculoskeletal specialist. That's kind of where I was being referred to for the hand thing, rather than seeing an actual hand surgeon. And then she told me like, yeah, I don't think you should go there because they're not going to help you, and I think it's going to be a waste of time. And then I pushed for one. I see one where no, we don't do EMG. He just did a full hand examination, just took in my whole history, just examined purely my hands. And he was really rough with it, actually. I mean, I was actually kind of hurting when he was doing certain things. But yeah, he just said like the speech like, oh, there's no magic pill, no magic shot or a cure-all shot to fix all your problems. He didn't really tell me what was going on. But then I messaged him about it, like what was going on after the appointment. He said muscle strain. So I was really confused, but like I wanted a time to like what do I should do to get better? Like he said like there's no timetable for getting better. He like I think he said some exercise in the message, but I was really unclear what to do. And then also the second general practitioner I mentioned, the one I saw like after the first one, she like thought it was tendonitis of the hands, and then the first doctor was thinking repetitive strain. So I was getting all these different diagnoses, and then I was talking to my parents like, yeah, I think we're done with this organization because they're not want to do anything. They're not going to help me. And then my parents want to keep going because it's our insurance, so it'd be kind of costly to go out of pocket. And we try to push to see the head of the group of the musculoskeletal specialists, excuse me. And we try to see him. I come in, and then the second guy I saw, the second specialist I saw, he just messaged me like, yeah, we talked it over, and like it was to be a waste of time for me to come in. He actually said like it'll be a waste of time for you to come in, and he just gave me some things to do like stretches or whatnot with my hands. But like whenever I stretched my hands or whatnot, it would just make my pain worse. So That was it. I was done, and
And now, at which point, how much time has elapsed since 2017 when you first had symptoms?
so this is pretty much everything I'm telling you right now. This is pretty much my whole summer. Just seeing all these doctors, pretty much my whole summer. Pretty much like at the end of that second special when I got that message. That was like near when I was about to get back into the fall for my school because I had to take more units. But yeah, then took about like a month or two because we like my grandpa got me to involved with this hand surgeon here in the area that was kind of well known. So he got me the appointment through out of pocket. So it was going to be another.
Who is this now?
Dr. Mazur.
Okay.
So 6 weeks away. And I had to wait, but it was a pretty long wait because I still had a really hard time using my hands. I was taking 13 units, 12 units, and luckily none of them were online, but a lot of them were just lecture based. But I still had a really hard time. Driving was a real pain to do at the time. I just couldn't drive. I remember when I was driving back from a class, I had no symptoms. My hands were just like it was hurting so bad. I had to just get out of the car because it was hurting so bad, and the pain was there for like 2 weeks after I was done with after that. I refused to drive after that. I refused to do so many things physically at that time just because I was so scared to aggravate my symptoms. So sure. Anxious to aggravate them. And and then that week where I was going to see him, we had the wildfires here. So that was a real trip. I had lost my house, and then it took that. Yeah.
Oh boy.
That Friday, I think I honestly didn't really think much of it because I was like my mind was so off with the whole situation with my hands. I was like, I just lost my house. Like, okay. And then
sorry.
Yeah. So I wait till Friday. Yeah, I see him on a Friday of the week. So like this a lot of smoke, and then we see him, and he was really kind. He took me in. He fully examined my hands. He did all these like tests. I like passed most of them, but like he said, he pressed on my thumb. He was like doing this test where he pressed on my thumb. I couldn't really resist him too well, especially on my right side. And then he gave me cortisone shots on the spot, like after everything was talked through and done, after he like did another X-ray of my hands to check for something. So he gave me cortisone on my right hand, and then he was like talking about like surgery with the carpal tunnel, how like it's like 9 out of 10 people get like no symptoms after a certain amount of time, and I was very successful. And then he like told him like, yeah, can you do the left hand for the cortisone? And yeah, he does that. And I walk out and I was like feeling pretty good because I thought I got the diagnosis, I got the right help at the time. And I was feeling pretty good. Like I was staying at a hotel at the time. But it's still my pinkies and my thumbs were still really hurting. Like the symptoms were really still there. And then not much really happens that ended because I was kind of in that fall area. Like once I transitioned to the January of 2018, that's when I like met with him again. Once we changed insurances, and I met with him about like talk about surgery because I was really fixated on getting surgery because at the time I was like, man, I think surgery is going to fix this problem. I think I could turn everything around. I could start using my hands again. So I was really fixated on getting surgery. I really wish at the time I would have rethought about that. So in January 2018, when I met with him that first week, we talked about the surgery, just what to expect and all that stuff. And I said, okay, can you do my left hand? So we do my left hand, and like around January 21st, I do the surgery, and I was in another full semester of classes, 12 units, I believe. One was kind of a hybrid class, but yeah, I was taking full units or full semester or full, excuse me. And as the weeks after the surgery went well, but as the weeks went by with the surgery, after the excuse me, I keep repeating myself. I was feeling a lot of pain. This pain really developed in my neck, like on both sides. I could just really feel it right there, and then the back of my upper trapeze was just really tight, really hurting. I was feeling all this really bad pain with my rotator cuffs. They were hurting so bad. I didn't want to move my arms, and the pain was so bad. I just didn't want to like. I avoided taking showers because I didn't want to lift my arms up because they were hurting so bad, and I was feeling suicidal at times because the pain was just so bad. Like I didn't want to take it anymore, and like I didn't know what to do really. I was just kind of scared for myself, and I luckily got help at my junior college. They have a free mental health help up there over there, and I saw the counselor there, and she took me in. She like promised me if I ever think about that, I'd call someone or text someone. But anyways, I go to see the doctor, or no, I go back because they have to take the cast off and the stitches. And I tell the doctor, like, man, I'm having all this shoulder pain right here. Like, he examines my shoulders. So he has me do PT for the shoulders because I think the PT was thinking it was shoulder impingement. But as the months progressed, I mean, it wasn't too bad after. I mean, I was still having a lot of pain with my shoulders. I was still having pain with my thumbs and pinkies. I can't remember anything significant between those events of that spring of 2018. But I do the right hand surgery in June 4th of 2018, and that went a lot better. Like I was doing the exercises they recommend to avoid like all this like shoulder pain, and then, but yeah, I mean that year was definitely a lot better. I mean it's kind of weird. Like they said with the surgeries, they say like you feel immediate relief with the hand pain right away, but I didn't feel really any different. Like both hands still felt the same. I didn't really notice any difference. My pinkies were still hurting. My thumbs still hurting. I still feeling like this neck pain right here. It was so uncomfortable whenever I looked down. But yeah, I'm going to kind of skip over the fall of 2018 because nothing too significant happened. But then once the spring of 2019 is when the symptoms really started to kick in again. I took an online class. It was a kind of a passion class. It was creative writing, and it was a lot of typing, of course. And of course, the symptoms just come flying back, even just way worse than before. My neck was hurting. Like I just couldn't like look at a TV. The back of my neck was just flaring up. My hands are always so cold. I'm feeling shooting pains in my armpit, tingling through my chest, and so bad. The pain was so bad, and I got super depressed because I thought I got through this. I really thought I got through this with the surgeries. I went to go back to see the doctor who did the surgeries, and I told him like everything, all the symptoms going on, like all the new symptoms, like just not with the hands, just all with the arms, the shoulders, neck. And I told him everything, and he kind of like took it all in. He's like looked at me like, "What were you doing?" Like, and then I told him like I was trying to like do stuff. I wasn't going crazy with video games or anything. I was just trying to do things. So they gave me a sheet that says I can go back to my normal activities, and I tried doing certain things. Yeah, and he just told me, like, he gave me this whole speech about how this is how the way it is. This is your anatomy. This is the way you're built, and the surgeries. He's saying the surgery should have worked, but you're that 10% that didn't work for the symptoms, and he didn't really give me anything to do. He just said he could order an EMG, but I had a really weird feeling back in my head that I was going to pass it. So since I already did it 2 years ago, and yeah, I felt really destroyed after that meeting at the doctor because I really looked up to him, and I felt really let down. I really started to start with the self-loathing of my self because I really blamed myself for getting this all these symptoms because I really thought it was all my fault with everything that was going on. But luckily, I kept my aunt in the loop about it because she's really knows his medical system very well, and she had me see.
What's her specialty, Kyle?
She's a podiatrist.
Okay, good.
Yeah, and so she has some colleagues she works with. She's up in Palo Alto. So I see one of her a hand surgeon. He takes me in. He was really nice, and he had me X-ray my elbows just to check if there was a bone spur going on. But then he just took on my whole situation. Like I told him like everything that was going on with the symptoms, and he's like, "Man, like this doesn't make any sense with carpal tunnel because like he's like thinking my age. And he's like thinking about this."
My connection cut out for a little bit. Who is this that you were seeing at this point?
I was seeing a hand surgeon at one of her colleagues at Palo Alto.
Okay.
He took me. Dr. Diaz.
Okay, good. So keep going. So he did some elbow X-rays.
Yeah, he like just did some like hand, just like some hand examination. He took in my history, and he was really perplexed with the situation because he's like, man, I never see anyone at your age deal with carpal tunnel. I never see anyone get symptoms of carpal tunnel within a year after surgery like this. And then so what he did, he's had me ordered a MRI of my cervical spine. He recommended me I see a neurologist. And then also I was seeing my general practitioner at the time, a different one through Sutter, because Sutter is my new system now. And I saw like a temporary doctor because my main doctor was really busy. He was like, did all the tests for autoimmune diseases like lupus, gout, all those, like he did ordered a full body x-ray. I do all that. Nothing significant pops up.
Was
then
this
I see
before or after your cervical spine MRI?
I think it was before. Okay. They're relatively close. I do the cervical spine or MRI, and that went pretty good. No, they didn't see anything significant. I do see my general practitioner, my regular one, and she like was really like suspecting that it could be rheumatoid arthritis. And she like does all these tests or examines my bones and joints to see if anything was tender. She orders some blood work, and I was very weakly positive with the CRP test. So she has me see a rheumatologist. So I see a rheumatologist at her clinic. I'm at my aunt's clinic. So I see her, but I think I see the neurologist first. So I do a lot of physical. I meet him. I tell him my whole history, and I tell him all my symptoms that are going on. And so he does a full examination of like my arms, my hands, and does all like the tests with the instrument that he used. And he has me see how I walk and like how my balance is. And he doesn't see anything. He doesn't really, we're kind of perplexed with what's going on. And then he was thinking about it, but he's like, okay, I'm going to order an EMG just to check. And then I think that goes like a little bit a week later, and I do the EMG, and then he's like, yeah, I don't see anything. There's nothing here I could publish these numbers with the EMG. And I was just really like perplexed right there. Like, wow, what's going on then if I pass the EMG again? And then I wasn't really sure what to do after that because he wasn't sure what to do. And then I do see the rheumatologist, and I do all the tests. She actually has me order MRIs with my hands, specifically both sides, after the meeting, because she had me do some more blood work, and she had me ask all these questions for rheumatoid arthritis, and I said no to pretty much all of them. I do the test for the hands. I was really anxious about it because I was like kind of thinking, man, this would be terrible to have rheumatoid arthritis at my age. And I did them, and they didn't say anything in my hands. I was really relieved because I was like, man, rheumatoid arthritis, man, that would suck. But yeah, and I go back to see the hand surgeon. Anyway, we just talk about it, and like, yeah, he's just so perplexed. He just doesn't know. He just said, I don't know what's going on. Like he just said that. Like I was kind of happy he said that because I don't want doctors just kind of saying stuff just to. Anyways, so I wasn't sure what to do. They just told me to just keep using my hands because I was like at the time very afraid to use my hands for such simple activities. Like I remember one time I was like brushing my teeth with the electronic toothbrush, and the vibration just made my hand just go into shock, and like I just couldn't use my hand that night because it was hurting so bad. So I was really avoiding such simple tasks that people just find so easy to do at my age. I was more just scared to do it rather than thinking I can do it, because I was just so anxious about getting the symptoms back. I was just really depressed at the time with the whole situation. Yeah, it was just such a terrible summer. And at the end, I mean, I felt relieved because I didn't find anything serious at the time. So I was, I go back to school, and I was taking half units because I was really still afraid to take full load and take some classes that required me to be, be really on with the class. 'Cause it was really hard because I had to use a lot of note-taking services for the classes, for the lectures. So that really helped. But yeah, as the months went by, the symptoms were just really bad. I just couldn't move my shoulders at that point. I just didn't want to move my shoulders. It was hurting so bad. And I'm like, okay, I think I need to see someone else because I need help. And I just can't get over this pain that I was dealing with. So my dad helped me try to find another hand surgeon in the area on the internet. Like they just try to type in hand surgeon in the area. And we find one, and we try to make an appointment with him. I think it was like a month or two out. So I have to wait for that. But yeah, I just still have to wait for that. And I got to see him in February, and I told him about my whole situation, or like most of it at least. And I told him about how I was having all this pinky pain, all this pain through my arms and my neck. And then after he talked about that, talked about our history, he was the first one to examine my shoulder blades. So he like looked at my shoulder blades, like he saw them, like he had me move it this way, like just looked at the back and see how I moved them, and then he checked for the position in them, and then he told me after, like, yeah, your shoulder blades are kind of out of place, and said stuff like that. I'm trying to remember because this was a while ago. So this is before like the lockdown happened, so this felt like a long time ago. But yeah, he kind of like gave me a like he's saying like the compression issues has come from above, but he never actually said thoracic outlet syndrome. So I never actually knew it was thoracic outlet syndrome. I actually never really heard of that phrase until the basketball player Marco Fultz got it.
So who is this doctor now who did the more?
His name is Dr. Bollinger, Michael Bollinger. Here he's
good. That's good.
But anyways, yeah. So he gives me a referral to occupational therapy or physical therapy. I go to this area. It was kind of awkward because I wasn't really sure what the diagnosis was. Like, yeah, he told me to do this. I have the paper, but I wasn't really told what was going on. So this is like a couple weeks before the lockdown happened. So like I was kind of knowing what was going on and I, we do some treatments in my hands. She has me do like some rotator cuff exercises, but I like stopped going because I like, man, this looks like it's getting really bad. So I stopped going, and then I kind of start doing these rotator cuff exercises at home, just like because my shoulders were hurting so bad. I just like I got to do this because my shoulders hurt so bad. So I just do like these simple like internal rotation exercises, external. After I saw the occupational therapist, and incredibly, like my symptoms got a lot better as the months went by during the lockdown. Like a lot better, like way better than any point before I got these symptoms. And it's crazy. But like once it got to like June or May, I had some really bad flare-ups because I was doing some exercise at home where I was like like throwing my arms around because I was doing cardio, and the whole arms were just like flaring up. Like I could feel all the nerves just going through my whole arms. It was hurting really bad. I could feel the tingling going through my shoulder blades. I got really sad again. I'm like, oh God, I got to deal with this again. And my parents convinced me to go see him again if that's what he told me, to come back if the issue still persists. And I go back, and then like we talk. It was like June, mid-June, and we go talk. He's like saying, like, yeah, this is gonna be a long process. He's like telling me like this is not gonna be like a quick fix overnight with the treatment. And right, he just said classic thoracic outlet syndrome. I like looked at him so bewildered. I'm like, what did you say? And I'm like, and he's like telling me like, yeah, I think it's thoracic outlet syndrome. And he just I was just so.
This is Dr. Bollinger.
Yes, Dr. Bollinger. Yes, because I was like, I was so like, oh my God, like I actually got a diagnosis, and like I was just so euphoric. Like I was so happy when he told me that, and like I walked out and like told my dad, man, I got that. I'm diagnosed with thoracic outlet syndrome. And we like look it up, and we're like, man, all the symptoms make sense. I'm like, I have had all these symptoms on the definition, and it's crazy because like my hands were always so cold for the past 4 years, and like my parents were like, man, why are your hands so cold? And like it made so much sense, and he had me he filed no referral for PT, so that awkwardly like I don't think it went through, so I had to come back a month or two like, hey, did you put in that referral? And then he put it in. I get a call from the PT clinic. I go see the therapist here in the Sebastopol, and she was really nice. She's been in the game for a while, and she gave me all these exercises for the scapular stabilizers, and she gave me like this belt for the rib to press down. I had to like press down. I don't know if I can visualize that well.
What's the name of this therapist?
Her name is Honest Day Poot, if I'm pronouncing that right. But yeah, she was really nice. I mean, she really worked really well. She was very good. I used up all the sessions. I had like 8, I believe. And when I walked out, I was symptom free. I was like amazed. I was so amazed. Like, well, I've never had such symptoms were just so good. And I was really happy. But yeah, I mean, as the months went by, I got a little too carried away with the usual computer stuff and just the stuff that I knew I should have avoided. And so as the months went by, I kind of get the flare up again. It was really bad. I was getting in my arms again, and I was getting a lot of vascular issues with my hands. I feel a lot of coldness throughout my whole arms. And then I kind of think I need to go back to see somebody. So I still go see Dr. Bollinger again, and he was telling me, what were you doing to aggravate the symptoms? I'm like, yeah, I was doing certain things like this, like texting and all that stuff that kind of, because when I use my phone, I have to I can't look down. I have to put it like this, but then it kind of aggravates it still. So yeah, and then he gives me another referral for PT, but I can't go back to the same person because they shut down the place. So I was like, oh, that's awkward. And so I go back to this. I don't remember how I got here, but I went to this different place and I saw this another PT. It didn't work out too well because I was more working with the aides, I guess what they call them, or the interns more than her, because she was working with like 3 or 4 patients at a time. I was like, wow, what's going on? And
So did these physical therapists know specific TOS physical therapy, or did you get the feeling that they were doing just kind of general shoulder stuff?
she was doing a lot of pec stretching, working on stretching my scaling muscles and all that stuff. But like a lot of the exercises I was being kind of told to do were like aggravating my symptoms. Like I was doing like kind of like some chest strengthening, and I was like, yeah, like I was like doing the strengthening, and I was like, man, I'm really hurting. I should probably say something, but like I don't want to say anything because I'm just so used to like not wimping out or like about with something. But yeah, like I just stopped going because like, man, I'm not feeling better at all with this with these therapies or these so I wasn't really sure what to do. So for no reason, I was kind of looking on Instagram for like TOS. I like just literally type in TOS, and I find this TOS education. I find the channel, and I found that like you could send in for consultation or find people in the area who could treat TOS. So I'm like, okay, I'll do that. And then I got all the names. Found Newkirk's name was the first one that popped closest to me. So I tried to make an appointment with Newkirk, and it was like pretty far out. But then the month or the week before I was going to see him, I just want to make this real quick. This is in 2021. He cancels it, or the person told me to cancel it. She didn't give me any reasons why, but she just canceled it. I'm like, well, bummer. I really wanted to see him because I've heard his talk. I knew who he was going to be like. I was like really excited to meet him. And then it got canceled. I wasn't sure what to do. So I look at all the specialists that Dr. Warden gave me, and they all didn't accept my insurance, or they just didn't take me in. I was trying to see Dr. Avery here in San Francisco, but the lady was saying that this is we're being reviewed for surgery, so she didn't take me in. Yeah, wasn't sure what to do at that time. And then I think like months later, we called Dr. Newkirk's office again. He's like, oh, he's taking patients again. I'm like, wait, he is? I'm like, because I thought he wasn't going to take patients again. Yeah. And then I have to wait another 6 weeks, which is like really nothing in TOS time. And then I meet him, and then like my symptoms were pretty good at that point. Like I was feeling a lot better. I go to see him, and like he was really nice about my whole situation, and like he took in all my history at least initial part. Because I mean, if I told my whole history right there, we'd probably be there all day. And yeah, he just took in all my symptoms, and he examined my shoulder blades. He said like, yeah, they're out of place. He said I got edema, a little edema, 1 out of 4 on the edema right here. He says my grip strength's weak for my age group. But yeah, he's like, yeah, I'm so glad he said, I'm so glad your symptoms are good. He says, I don't think you're a candidate for surgery. I don't think you need an MRI at this point. So he recommended I see a physical therapist, and I'm like, he tasked me where I live, and I say, yeah, I live in Santa Rosa. He's like, oh, I know this guy named Todd Sorehouse, and he recommends you see him, and that takes another six weeks, of course, because he's really popular there. And then yeah, I've been seeing him. It's this is recent, like maybe I started seeing him a month ago. Mm-hmm. It's going pretty good. He's doing the invest edge loop technique, so he's having me do a lot of diaphragmatic breathing, a lot of just we're taking it really easy, like just doing all this stuff. He had me stop doing some exercises that were strengthening, and yeah, it's been going really good. I've just been doing all the exercises he's giving me. I'm seeing him tomorrow, but yeah, he's been really, really good. He's very good at communicating the language of TOS. So I'm like so perplexed with all the language because like Dr. Newkirk was throwing all these words at me. I'm trying to remember all of it. I'm like, yeah, but yeah, it's going really good. I'm feeling really good right now.
That's great. So we've heard good things about Todd Soares. I've spoken to him about a month ago.
Okay.
And, very nice man.
Yeah.
I'm going to hit a few points of your long story. And number one, it really gets me here to listen to your story and some of the ups and downs, not just physically, but emotionally. And, I get the feeling how strong you are to have gone through this, but that makes it even worse to hear about your downtimes. So I'm glad you're here sharing most kindly with everybody else. Thank you for that.
Yeah. Yeah.
How did you feel the difference between the docs who said, yeah, you know, I looked at your hands, I held up a flashlight, they look fine, and the docs later who did, even though they didn't come up with a diagnosis, but they did a lot of tests, the blood work, the cervical spine MRI. What was the difference in feeling after seeing those two different docs?
Well, the ones that like did all the extra work, I felt like I was really being listened to, or they actually really took into account how I was feeling. Um, I just felt like I was a little bit panned off a bit with like just doing the hand thing and then just kind of don't really do anything else. But yeah, I really felt like I was really appreciated or really thought of when the doctors were really trying to see if what was going on. And I really liked the doctor I met who just said like, yeah, I just don't know what's going on. Because he just told me like, yeah, because I really think that there's nothing wrong with saying I don't know when it comes to evaluating disease, because it's such a what I was dealing with. It's such a complex issue to diagnose. And yeah, I mean, I felt really the doctors that really did all the work and like took me into like just I really remember them the most fondly. So, but the ones that kind of just panned me off and real quick and just I just don't really want to remember that well, or I just don't remember as much.
So that's a common thread for TOS patients, that it makes a huge emotional difference. The doctors who try,
Yeah,
even the doctors who say, as you so well pointed out, there are doctors who say, look, I don't know, but let's do A, B, C, D.
yeah,
There are the other doctors who say, I don't know. And what are you supposed to do with that? It's kind of like, and there's the big end at the end.
yeah.
So then how did you feel when Dr. Bollinger just spit it out and said, you've got classic thoracic outlet syndrome?
Ugh, best day of my life, honestly, because that was such a relief, weight off my back. Like no joke. Like I had no symptoms for like 4 weeks after he told me that. I just had so much anxiety or stress around what was going on, and just thinking about what was going on. That just it just really relieved my mind, knowing that I actually have something to work with. Um, yeah, I was super relieved that found Dr. Bollinger. And yeah, I mean, I don't think you realize how much of an impact he made on me emotionally when he told me that. Because yeah, but yeah, I felt really relieved when he told me that.
Totally, absolutely understandable. My God, something you could work with, right?
Yeah, yeah. Because I
So
just
did you do a lot of reading and educating yourself after you got that 3-word diagnosis?
yeah, I mean, I looked at some like YouTube, like just some things to do on like exercises you could do to help with the like I do a lot of lying on a foam roll just to stretch out that chest, get that chest open. And I didn't like read a lot of literature at the time compared to when I saw this channel, because I've seen like pretty much all these videos with all the literature. But I didn't do a lot of research at the time into this. When I first got I was more just looking it up and just, man, this is all the symptoms I'm getting, and I just stuck with the exercise I was given and worked with the PT was doing me. But then, but yeah, once the symptoms kind of flared up, I felt like it really helped me to learn more about the anatomy and the literature of what's going on, about why certain things I do, why it causes this issues. So yeah, I think really just no, I'm still learning a lot. I mean, I just so much I need to learn about it, but learning about it's really helped me understand the disease better.
So you felt empowered by just the diagnosis.
Yeah. Yes, I did.
Do you think back to what you would have done differently if you could do it all over again?
Honestly, I probably wouldn't change anything, because like I'm just thinking about if I like changed about what I did at the time, I wouldn't be who I am today, because like I really take pride in taking care of my health. It's just getting to you. I didn't really think about health at all at that age. Like I had such a bad diet. I never really took uh, care of my mental health and all that stuff. But then like it just this disease really took me helped me take pride in taking care of my health and taking care of my body, because I only got one, so I got to take care of it. And um, I don't think I would change anything really. I mean, maybe the only thing I'd probably change is like once I change insurance, I'd probably go straight to Newkirk before all those hurdles, before my symptoms started getting worse. But honestly, I wouldn't really change anything, because I just wouldn't be who I am today if I changed it. So
Wow, that's a very positive message.
yeah,
Really appreciate that. First of all, I'm really sorry to hear the stuff that you've gone through, not the least of which is a house burning down.
Yeah.
But for you to say that it strengthened you is really the best positive you can take out of all of this.
Yeah.
Right?
Yeah.
I appreciate that. So I just want to make it clear for people who are viewing, we've not done an MRI on you. I have no proprietary interest in you or fees that I'm getting from you. We're really doing this because we want other people to learn and maybe move their progress a little bit faster than what you did, because you really suffered a lot.
Yeah.
So right now, you've seen Dr. Newkirk. You have a diagnosis from Dr. Bollinger, and I'm sure Dr. Newkirk confirmed it. You feel good seeing Todd Soares, the physical therapist,
Yes.
and you feel in control of things. When you get little flares, do you recognize it early?
Yeah. Yeah. I try to back off when I'm doing something, and I got a lot of exercise I feel like I could do just to calm things down. I just I used to be like as a kid, because I didn't really think what was pain, and like because when feel pain, I just next day I feel fine, and but I try to really take pain as like a signal, like, yeah, stop whatever you're doing or just change whatever you're doing. I've had to really modify a lot of the things I do in my life to accommodate TOS. It's frustrating, like very frustrating, but like I just have to work with it, and I'm trying my best to get more confident with my body, with trying to take more classes at school, and because yeah, just one of the biggest problems with me mostly is just being more confident about my body with my hands, and but yeah.
So would you say your symptoms are 80%, 90% gone? How much improvement do you think you have after your trip through all this?
So right now it's been like maybe 1% lately. I just get occasional coldness or occasional tingling if I have my arm in the wrong place, or just I'm just being weird, just like laying on my arm and my arm goes numb. But like,
So
uh,
1% of the symptoms you used to have.
yeah, just or maybe not
Wow.
times a lot of times zero. I mean, it's just mainly coldness at times if I'm in the wrong position. But yeah, I feel a whole lot better when I first got this. It's crazy.
Wow, that is great.
Yeah.
Have you done any social media or Facebook groups or anything like that?
No, I'm pretty shy about this stuff, so yeah, I haven't really talked to anyone about this. I haven't met anyone about with TOS. So that's kind of one of the main reasons why I looked up TOS on Instagram, because I was like kind of curious if there was any groups that have this disease. I found this like group on Instagram, TOS sucks. I'm like, yeah, it definitely sucks. But yeah, and I found TOS education. But yeah, I'm like a little bit surprised. Like, yeah, I didn't think there was so many people out here, because I was like, they say when you search on Google, it says like rare or like the cases, but like it doesn't seem like it's rare. But yeah, yeah,
No, it doesn't seem like it's rare to me either.
yeah,
Maybe the official diagnosis is rare because of situations like yours where docs don't approach it.
yeah,
I can tell you, hearing some of that story and clicking in my mind a bunch of medical things, if I had a patient come to me who had bilateral hand symptoms, I wouldn't be thinking muscle strain. I mean, it could happen. I wouldn't be thinking repetitive stress quite as much. I'd be thinking, number one, make sure the cervical spine is okay, right?
hmm
You know, or like your second group of docs who really looked for inflammatory disease, arthritis, you know, look for something that's a systemic disease, because two hands at the same time, there's got to be something centrally that's getting to both hands. You know, a doc doing a B12 test, you know, there are rare cases B12 deficiency can cause a neuropathy, but that's kind of down the list. Yeah, there's a lot more common things. Just even a cervical disc herniation can cause bilateral symptoms. So, hearing your story, I'm guessing that some of your docs were pretty busy and too busy to really pursue much. I'm really glad to hear the group of docs who didn't make the diagnosis but kept going for a while. You know, they ordered blood tests, cervical spine MRI. They thought maybe rheumatoid arthritis. Arthritis is one of those systemic diseases that could get both hands. Sometimes symmetric, sometimes asymmetric.
yeah,
But both hands being involved is not at all uncommon. So those docs at least gave it a good college try. I'm glad to hear that. And then, yeah, you lucked out with Dr. Bollinger.
yeah,
Just as a point, a teaching point for people who are listening, there is a good amount of medical literature about people who have carpal tunnel syndrome diagnosed and treated, and they do fine for a few months, and then the symptoms come back in the elbow. and then the symptoms get up to here. So there's something called multiple crush or double crush syndrome. When you press on a nerve proximally, all the nerves distally to the elbow, to the wrist, can be more sensitive than usual. And therefore, even minor compression can cause symptoms. So sometimes docs get fooled. And I think most of the hand surgeons we work with, when they see carpal tunnel, they do look up higher to make sure there's nothing more proximal, which it sounds like Dr. Bollinger did. So he was right on top of it.
Yeah.
And I think that really changed your pathway immensely.
Right. Yeah.
So what advice would you give to people right now? Somebody who's watching this and says, I don't know, could I have TOS? Well, what advice would you give to them?
Oof. That's a tough one.
Don't go through what I went through.
Yeah, just don't do. Well, if you're not happy with what you're being told with the doctor, just keep going. Like, just keep what I did. Just keep seeing doctors. If you just don't like be okay with the pain, because pain's not fun, and it's just, especially with TOS, if you just keep letting it progress the way it does, it could go really bad. And just keep searching for a doctor. If you're not happy with what you're being told, just you're allowed to just keep seeing the next doctor and get that answer. And that's why I say just keep being you have to be your best advocate as a patient for your health. The doctors aren't responsible for making sure what you do want to do. You got to do what you need to do for your health. So that's what I have to say.
Yeah. So the docs who said, look, deal with it. How old are you, Kyle, by the way?
I'm 23 right now.
All right. So telling a 21-year-old, otherwise healthy male, yeah, deal with it. It is what it is. I hear that, and it's troubling to me to hear that. I've been lucky so far. I haven't had very many health issues, and again, compliments on your strength to get through this to this point, because I think certainly you didn't have all the best support along the way.
Yeah.
So let's talk about the mental health part of it a little bit.
Yeah.
You've shared with us. Thank you very much. In our experience, TOS has gotten some patients really, really, really down. And I think that in the literature, that's not played up as much as it could be. We do know that patients with chronic pain can have higher degrees of depression. But I think some of that medical literature tends to emphasize people who are older, or maybe people who have drug use problems. But we don't see a lot of it with young, healthy people who get a disease like TOS.
Yeah.
TOS is not the only one. But since we're talking TOS here, it's common to have an emotional component to it, which you brought up.
Yeah.
And I will say that there's some docs who, will see that emotional component and say, okay, I don't know how much pain the patient has, but obviously they're emotional. And some docs will take that and say, okay, they're emotional, so I'm going to discount the pain report. But there are other docs who are smart and say, well, maybe they're emotional because they have a lot of pain.
Yeah.
So for our viewers, if you're struggling with that, or if you get docs who are blowing you off, you need a different doc. The emotional part of it is part of it. It happens with all patients with pain like this.
Yeah.
So let's see if we have some comments here. So I know we had a comment from Virgo8708 who says, I feel your frustration, Kyle. I have been on a long journey myself.
Oh, thank you.
And this is really valuable. I think that, other patients who watch this are going to say, Kyle's just a regular, young, healthy looking guy. It can happen to anybody. So is there something else that you want to add at this point that I haven't asked about yet?
No. Yeah. I think everything's been said. I just think the mental health part was just such a huge part of dealing with the TOS or coping with it, because I just didn't know what was going on. I felt really depressed a lot of times, and at the worst of times, I felt kind of suicidal. I needed help, and it was so hard to cope with the situation. It was kind of hard too with the doctors to relay the information, because I'm so under such duress and stress with the pain, and they want to ask you all these details, like what are you feeling here? I'm trying really hard to tell you every pain because I'm hurting, and I'm just really anxious and stressed out by the situation. And I've had doctors who kind of just blow that off, or for just.
So you told your docs, I'm feeling really down about this.
Yeah, I mean, some doctors just kind of like the hand surgeon I said, Dr. Diaz, he said like he knew like something's really off with me emotionally when I walked in. And he was really nice about it. But
Good for him.
anyways,
It's really good to hear that.
yeah.
What about the system? How do you feel? I know you're only one patient, but you've been through a few different systems, so to speak. How do you think the medical system could make this better for TOS patients?
Man, I'm trying to think about this question because I'm not sure if I have the answers, but part of me doesn't think it's like an institutional problem or a system problem because I feel like the literature is out there about TOS, but then there's still like they're not doctors are still not know about this. So I think more it's about just learning about the disease, just finding that right doctor because part of me doesn't think it's the system's fault for why we're not getting the TOS. Yeah, it's frustrating that we go to a doctor, they don't know what's TOS, so they don't know where to send you. But then I just think you just got to find that guy that knows TOS, or I don't know if that's a really good answer or not, but it's just a part of me doesn't think it's a system problem.
Before I get to a next question from a patient, I think that's really good. And I wanted to ask you, did you have any doc who you brought up TOS and said, no, it's not TOS? From your story, I don't think it sounds that way. I think once you got the diagnosis, you only saw good people. Is that fair?
Yeah, because I honestly didn't even know that phrase TOS
Sure.
until Dr. Bollinger brought it up. And I did hear it from when the guy, basketball player Marco Fultz got diagnosed with it. That's when I actually heard that phrase. And it's funny when I look back at it because I watched that video like a year ago and I was like, I actually had it. And then, but yeah, I never asked a doctor like, yeah, do I have thoracic outlet syndrome? Because I didn't know that text of it. Or I just know I've heard about carpal tunnel. I've heard about cubital tunnel syndrome. And
you had heard about those.
Yeah. Yep. But yeah, I never asked a doctor who like kind of just denied it was going on. I didn't ask him if I have TOS.
I want to get back to Markel Fultz a little bit later, but let me hit a couple of questions here. Jimmy from Sturgis, Montana says, what activity caused the most symptoms when they first started?
I would say the PC gaming definitely caused the most symptoms, or I noticed the most symptoms because I played this game where like the games were last hours, and somebody would like just at my age, you'd be we would play games for a long time.
You just get absorbed in it, right?
Yeah, I could play sessions for 7 hours, like totally fine. But I just noticed when I was playing the game, the computer, my pinkies was getting really sore with the mouse. The tips of my fingers were getting sore when I was typing. But yeah, that was the activity. I think I remember clearly that I was getting my symptoms aggravated. Somewhat with the console gaming, I was a little more comfortable with that, but I was still getting aggravated with that. And also with the weightlifting, my hands were just getting sore all of a sudden. So, yeah.
And plus, you were taking all these credits in school.
Oh yeah, the online classes far out. Yeah, all the typing that was really getting my fingers aggravated, or they just got so sore when I was trying to type it. Like I was able to make it through the semester because I found like a free voice program for text to speech,
right?
And they had like this class had me do like type in like 300, no, like 300, like a lot of the typing, just a lot of typing, and I was able to get through that semester, luckily.
Yeah, you were hitting a bunch of risk factors: computer use, gaming, and then athletics, particularly weightlifting. So
yeah,
boy, you were really, without knowing it, putting yourself in a high risk situation.
Yeah.
Christoph says, how did you cope with emotional problems when you were at your worst? Any tips you learned from this experience?
Oh boy. Honestly, when I was at my worst, I really shut down. So I can't really give advice to what to do because once the pain's all there, it gives me back all those memories of when I deal with the pain, and I just really just shut down. I'm not who I am. But I try to do a lot of things like just mentally, like thinking like, man, the symptoms should go away in a couple of days. It should usually, because that's always happened. I get the symptoms and I just goes away. So I try to think that mindset. I'm going to weather the storm. It should be fine.
So when you got symptoms, you would just stop doing anything?
Mostly emotionally, because I'm like, I would stop, but like I would just mostly shut down because I just, all the memories it brings back and all the pain I would deal with. I just didn't want to really do anything. Just I don't know how to explain, but yeah, I just didn't want to do anything. Because it was the pain just gives me so much bad memories. Um, but yeah, I just try to do like things to keep my mind positive about the situation. Luckily, I haven't been back in those, getting my mind back to those places because those are just places I just don't want to go back to ever again. Um,
Sure. Do you
uh,
have a good support group at home?
yeah, I got really good support with my family. I see a therapist every couple weeks. Um, she gives me good techniques to deal with. I meditate often, so I really try to relax my mind and do things to self love and all that stuff. And yeah, I don't know if that answers your question.
That's interesting. Do you think TOS patients sometimes take you mentioned this before, Kyle, and it's really the first time I've heard it, but it makes a lot of sense. Do you think some TOS patients take it upon themselves that they're at fault because the doc says my tests don't show anything?
Yeah, I mean, 100%. I really started my self loading when the hand surgeon, I really looked up to him, and I just when he told me like, yeah, I didn't think he really spelled it out for me or told me that was what he was saying, but like when he was like saying like this is the way you're built, it's just the way it is. I really took from it like, yeah, it's my fault that I got all these issues, and I really blamed myself for the whole situation.
Hmm.
I was so self-loathing. I really just did not want to be me or just. But luckily, Dr. Diaz, the guy I mentioned before, he just told me like it's not your fault. It's not your fault. This and it really helped to hear that. And it was just so. I'm still struggling a little bit today, blaming myself for, it, but I'm feeling a lot better myself physically. So, yeah,
Maybe this is why, connecting to other people who have it. And,
yeah,
we have people commenting on our Instagram as well as Facebook. But, hearing other people have this, just like people are listening to what you're going through emotionally, hopefully you can realize that this is common and it's not your fault in any way. It doesn't matter that I say that. You have to internalize that. But man,
yeah,
a lot of patients go through these structures. The reason I asked you the question about a doc denying TOS to you is because some patients go through that. And I think you can probably imagine how bad that feels. Yeah,
yeah,
the
definitely,
TOS, right, sure.
yeah,
You know. So it took you a while to get diagnosed, but I will tell you when I first started doing this 20 years ago, Kyle, it was very common to see patients who had gone 10 years or longer without a diagnosis.
wow,
It's just so hard on them and their families.
yeah, wow,
So as bad as your story is and the stuff you've gone through, I'm still glad that it's relatively shorter now. Angela Porcelli said more doctors should specialize in this. I think she heard your comment about the fact that some docs just didn't even know about it, didn't think about it.
yeah,
And thank you, Angela. I think that's totally true. I think some of that can be changed from people like us in patients. If we have docs who connect with patients and we listen, and we have patients who have all this power through social media that we never had before, we can raise awareness. You had heard of carpal tunnel syndrome before,
yeah,
but you hadn't heard about TOS.
yeah,
And so you wouldn't even know how to search. If
yeah,
you search for neck pain or arm pain in Google, you would get about 10 million, entries that are all over the place.
yeah,
And it's not helpful at all.
yeah,
So let's get back to Markel Fultz. Interestingly, for people who don't know, he was, I believe, the #1 overall draft pick in the NBA.
yeah,
And he started playing, and he sucked. And he had all kinds of issues, health issues. Interestingly, just yesterday, I was reading a lay article about him, an interview with him. And the title and subtitle said something like, Markel Fultz is recovered from this disease that even MRI can't find. Now, I'm obviously a little bit biased in this, as you might understand. But they interviewed him and he talked about that. He repeated that. Now, MRI can't even see it. I wish I could reach out to him and say, maybe you could use your platform to help spread the word. And in a way, he is. We've seen, several Major League Baseball pitchers diagnosed. And I keep hoping that each one of these celebrities that gets diagnosed, that it gets a little bit more in the public eye. So people like you don't have to go through all this. You find
yeah,
it earlier.
yeah,
So my hope is that patients, regular people, can help spread the awareness of it so that docs have to pick it up.
Yes, definitely.
And I'll make one other point. There is no specialist really that handles TOS. We've seen specialists, obviously radiology, internal medicine, pain, physiatrists, surgeons, not just any one type of surgeon, orthopedists, vascular surgeons, neurosurgeons, neurologists. So you can't go look for one type of specialist, but you have to find someone who has TOS experience. But that means first you have to find out the name of the disease, right?
Yeah.
And once you got there, then you were able to really navigate for yourself.
Yes, definitely.
Let's see if we have, okay, so Gia in Fresno has a question. How many doctors total and what specialists did you see before you got the TOS diagnosis? And what specialist finally confirmed TOS?
Okay, so hi Gia. How many doctors total? So definitely more than I can count on my hand. I went through I had to go through 2 systems to actually get the diagnosis. I've seen hands. I've seen couple of general practitioners. I've seen musculoskeletal specialists. I've seen a neurologist. I've seen a rheumatologist. I've seen all the specialties. And the person who diagnosed me, Dr. Bollinger here, and he's in Healdsburg now. He's a hands orthopedic surgeon with a specialty in sports medicine. But yeah, he's the guy that gave me the diagnosis. The first guy to say I have TOS. And of course, Newkirk was the guy to rule it in. He's a neurologist. But yeah, I had to see a lot of doctors before I got to that point of Dr. Bollinger. It's more than 10, I can think right at the top of my head.
What was the first system you were in? I think it's okay to say.
Kaiser.
Okay. All right. We've had our share of patients who have dealt with Kaiser. You know, Kaiser does a lot of great work for a lot of people. Mm-hmm. I think it's a little more challenging for him to have a disease that's a little bit less understood. You know, TOS has this rap of being rare. You mentioned this yourself. And I don't think that's true.
Yeah.
I will throw in my little medical points here. There is no gold standard for the diagnosis. We have ways to put MRIs together with clinical exam, but there is no gold standard. And therefore, no one knows exactly through gold standard diagnosis how many cases of TOS are out there. But we're seeing it a lot more than just 20 years ago. And we have all these people using devices, playing games, doing overhead athletics. I think computer use in particular, at work and at home, and the small devices that everyone gets in weird positions, like you said, neck down, Kyle. So I think that's driving this increase along with slowly growing awareness. So I don't think TOS is rare. I'm just going to throw in that right now. All right. Maria in the Bay Area says, what exercises did your new PT have you stop right away? That's a good question.
So I don't know why I was thinking, but I thought strengthening the pecs was a good idea for TOS. And then I was telling Todd Soares about it. I didn't tell Newkirk because of just time. And he's like, yeah, if you told Newkirk that, he would told you right away to stop right there. So he had me stop doing the chest press. But he said everything with the back was fine, the arms was fine. But yeah, that was the main one he told me to stop right away. I did definitely stop doing ones that are overhead because I just knew that was going to be bad. So, but yeah, Todd Soares told me stop doing the chest press for now. But yeah.
So Steve Talikowski, who you may have seen his videos here.
Yeah.
He talks about the edge low method as well, where he's got a lot of experience, and absolutely, there's no strengthening in the beginning. You need to meet some milestones, right?
Yeah.
So I'm glad that Todd, and when I spoke to Todd, he had asked me questions about the edge low technique, which he's familiar with. And so I'm really glad that you've hooked up and you're seeing him.
Yeah.
And it sounds like you feel confident in his care so far.
I feel very confident. He's been very good at communicating the language of TOS and just taking it very slow with the exercises. We just started out with just the first thing he really gave me to start out was diaphragmatic breathing. And he's working me up to do it on the chair. And he's giving me this, Talikowski showed in the video too with the ball and the stick. I got that. And I do the rib thing or put on the first rib. He has me do a roll on a foam roller. So I'm kind of rolling back and forth. He's trying to get the ribs moving. I'm trying to remember what he wanted me to do specifically for that. So those are the main ones he's having me doing right now. He has me doing the scaling stretches, trapezius stretching. But those are the main exercises he's having me doing now. And now I'm at scapular stabilizer exercises, just doing the W's, Y's, T's, because he examined my my whole like physical profile. He said everything looks really good. He just said like some things were a little off, but yeah, he just said I think he just yeah, it's probably not his typical situation, because usually when someone with TOS comes in, they're probably like all in pain, like this can't move or anything. But
Yep,
yeah.
yep. So Todd Soares and Steve Talikowski, for our viewers, if you want to be put in touch with these people, just feel free to contact us. Just like with Kyle, we will connect you with docs or physical therapists. We think that's one of the values we bring to help people find those specialists out there who can really move things forward. And I got to say this, Kyle, I'm pretty sure at this point I'm never going to see you in my MRI scanner, because it certainly seems like you're on the right path with the diagnosis
Yeah.
and really taking control of things. So that's really heartening to hear.
Yeah.
Hopefully you will follow us on social media and help spread the word. And hopefully we can get you back a little bit in the future for, a progress report.
Yeah, I'd like to. Yeah, once I have not done with Dr. Todd Soares, but yeah, I'd like to come back.
Awesome. Well, it would be great. I have another question here. I'm going to ask if you don't mind, which is I've got a couple. So Bailey in New Zealand says, how much does stress impact your symptoms?
Oh, geez. Hi, Bailey. A lot, a lot. Especially anxiety too. I just once I get all stressed or tense, like let's say like first week of school or something, my symptoms go like crazy. Like it just goes crazy. Whenever I get so anxious, the symptoms get really, really bad. So I try to do things to calm my mind or just, yeah, it impacts it a lot. I would say that. It sucks.
Do you feel like, besides the physical improvement, that you've made mental improvement as well?
Definitely, yeah.
So you can bounce back more quickly when you have a bad day.
Yes, yeah. I think because I've been doing daily meditations just for the mind. I've heard do mindfulness, and it's actually, I thought like it was honestly kind of a joke to do that, but then I did. I'm like, wow, this really helps with my mind, just to relax and take 10 minutes just to think about nothing, or just decompress. Because with this is TOS, my TOS just gets worse if I'm like getting really anxious or just really stressed out about something, or because I gotta sometimes I gotta relax, or my symptoms will just go out of control. Once I start calming down, I'm like, oh, my symptoms are better.
Freya, Herb, we can put up Freya Moon says, I have bilateral symptoms of TOS, and the vascular surgeon says it's not likely to be TOS, but the neck. So I'm going to actually take part of this one. I think that one of the confounding variables in TOS is disease of the cervical spine. So you could have a disc herniation or degenerative joint disease, and it can press on multiple nerve roots or the spinal cord. And as we discussed with Kyle's case, that may cause bilateral symptoms. I will say, though, that most people with TOS are younger and less likely to have disc herniations or degenerative joint disease. So older people, 50s and up, let's say, are more likely to get those disc disease or degenerative joint disease, and therefore more likely to have nerve compression from the spine than from TOS. Our study, when we do an MRI, we always include the cervical spine just to rule out the unusual case. But if your surgeon thinks that it's coming from the spine, do an MRI. That's real obvious. If you have bilateral neurogenic symptoms, then you can rule it out. Get a normal cervical spine report, and then you got to look at the thoracic outlet. And I hope that answers your question. I think it's more of a medical question, Kyle. So
yeah, I have nothing to add to that.
All right. So I want to thank you, first of all, for finding us. It's really cool that you found toseducation.org. toseducation.org is run by Herb Rep. Does a great job recruiting speakers like Kyle. Has just done a great job. It's just a regular Joe just coming on and speaking to the internet. I love it. It's really so heartfelt, and I think so helpful for a lot of people. Herb also gets a lot of local experts. I'm going to look on my calendar right now to see who's coming up our next visit, which I think is, well, maybe Herb will send it to me, but there we go. TOS and Athletes with Vernon Williams. Vernon Williams, very interesting guy from Cedars-Sinai in Los Angeles, and that's February 1st. Now, we might schedule something in between. With the holidays, we have to work around that a bit, but we'll do our best because we know that this helps a lot of people. Also, I encourage you to follow us on social media. Any help we can get to spread the word, to boost our numbers, we love that. Any conversation we can host and contribute to is really good for a lot of patients and hopefully some docs. Again, we are tosmri.com, that website. You can contact me with any questions on that. If you follow us on social media, like Instagram, Facebook, it's always TOS MRI. You can also look up TOS Education on Instagram. They've got a big following. Again, Kyle, I want to thank you for your time and for your sharing. I think it really helps a lot of people to hear this.
Oh,
and,
yeah.
Do you have any last thoughts you want to add?
Oh, I just want to mention, if anyone's watching this after, if they just want to comment their questions, because I could just see the comment. I'll answer if you have any questions, if you're able to catch me on the live stream. But yeah, I don't have any other lasting thoughts. Yeah, I just think, like I said earlier, I think everyone needs to be their best advocate when it comes to their health. So
excellent advice. And I want to thank you personally again. So I'm Dr. Scott Worden, the TOS guy. Remember, don't guess with TOS, okay? Get an MRI if you need it, but see a doctor who's a specialist in TOS first. All right, thanks for your time, everybody, for viewing. Kyle, thanks again, and we'll talk to you soon.
bye, everyone.